Make a noise, a bird noise, Mike.
I am Bitsy. I'm the LPN student. I'm going to do a check off on the NG nasogastric tube insertion. So first thing I would do is my co-wipe. So I'm going to check my doctor's order. I'm going to check my patient's allergies. I am going to assemble all my equipment. I need my gloves, an NG tube, a cup of water, a basin, the lube, some tape, and my towel. I'm going to wash my hands. I'm going to identify my patient by asking to state his name and date of birth and checking his wristband. I am going to provide for privacy, closing the door and closing the curtain. And I'm going to educate, explain, and evaluate the procedure. So now that I have gone over that, walk into the room, knock on the door, close the curtain. Hi, Mr. Jones, I'm Bitsy. I'm going to be the one putting the NG tube in that the physician ordered because of your bowel obstruction. So can you tell me your name and date of birth? He states it. I'm checking it on his wrist. Do you have any allergies? He states, check it on his allergy band. I've explained that I'm going to do the NG tube and the reason that I'm going to do the NG tube. So I'm going to go ahead and raise the head of my bed up into the high Fowler position. Okay, I'm going to go ahead and wash my hands and put my gloves on. I'm going to pull my bedside table closer to me. Mr. Jones, I'm going to place a towel so that we don't get any stuff on you. And during this procedure, I'm going to have you hold this basin under your mouth so that if you gag or vomit, that will protect it. So he'll be holding that. I can also have an assistant hold it if need be. During the procedure, I'm going to have you drink water. Once this gets to your gag reflex, I'm going to instruct you to drink faster and faster and faster. That's going to help to guide the tube down and make it a little easier on you. First thing I'm going to do is go ahead and measure my tube. When I get ready to measure, I'm going to inspect his nares. I'm going to ask if he's had any kind of trauma or if there is one nostril that he's breathing out of better than the other. I would use the one that he is not as clear as the other one. And so I'm going to measure from his nose to the tip of his ear down into the end of the xiphoid process. Once I have that, I'm going to come and put a piece of tape on it so that I know where my measurement is and I don't try to go past it. I would then lubricate the end of the NG tube approximately 3 to 4 inches. When I come over to do it, I'm going to instruct Mr. Jones that I'm going to help him to bring his chin down to his chest, which will make the guiding better. And I would have him hold the cup in his hand. Once I insert into his nostril, he may feel some resistance, a little bit of pressure. I'm going to continue to insert. As it's inserting and hits his gag reflex, I can back up just a tiny bit, give him a couple seconds to take a breath. Once he's ready, I'm going to tell him to drink. Continue drink, 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 drink. Once I have reached the end where my tube is, I am going to secure it, paying attention to where it stops at, and it is right at the 48 mark. Place my tape on. I'll place one more piece just to make sure. Right across the bridge of the nose. Still at the 48 mark. So then I would send my patient to x-ray to verify that the placement is correct. Once the patient comes back from x-ray, then I'm gonna go ahead and secure my tube to the patient's gown. I can remove my towel at that time. And I'm gonna inform the patient that I was ordered to put it on intermittent suction. So I would, while the patient was gone, I would have taken off my gloves and washed my hands and put on a new set of gloves. So now my patient's back from x-ray. I've told him about the suction. It's attached to the patient. Where is the part that y'all are hooking up? Like, go ahead and connect it. And I would turn it on to intermittent, keeping it between 40 to 60. I may have to go as high as 80. And once the suction is on, I'm gonna note any kind of gastric content coming back into the tube, measuring how much and what it looks like, whether it has blood in it or if it's clear or more of the yellow acidic looking. And I'm gonna go and document everything, including where the NG tube was here and how much is left coming out. And I would go ahead and put my bed back into the lowest position, put the head of the bed down, not leaving him flat, but leaving him more in a semi-Fowler's position. And then I would document.